If you've been told you need back surgery, whether it's for a herniated disc, spinal stenosis, or degenerative disc disease, I want to help you pause and think it through. Not because surgery is always the wrong option, but because too many people are rushed into it without exploring the full picture. And once you go under the knife, there's no going back. So in this video, I want to walk you through what the research actually says about back surgery outcomes, why many surgeries don't produce lasting relief, what conservative non-surgical options you still may have even if you've tried everything else. If you're considering surgery, this may be the most important 5 minutes you ever watch. Back surgery, whether it's a discectomy, laminectomy, spinal fusion, is usually intended to remove pressure from a nerve or stabilize a joint. And in the right cases, that can make a big difference. But here's the reality. Most people aren't told. Many spinal surgeries don't result in long-term relief. Some create new problems like instability or scar tissue. And some could have been avoided with the right conservative care. In fact, a study in the Spinal Journal found that patients who had spinal fusion were less likely to return to work and more likely to need long-term pain medication than those who didn't have surgery at all. That's worth thinking about before you commit. So why doesn't surgery always work? Because most surgeries only address structure, not function. Let me explain. Just because the MRI shows a disc bulge, degenerated disc, doesn't mean that that's the true source of your pain. Plenty of people have a scary looking MRI, but no pain. Others have pain, but with normal scans. Pain is complex. It's not just about what you see on the screen. It's about pressure, inflammation, nerve sensitivity, movement patterns. And if those aren't addressed, surgery might relieve one issue, but leave the others untouched. So what should you do instead? That's where the BackStrong Framework comes in. I built this program for patients who were this close to surgery, but still wanted to try something natural, structured, and research-backed. It's not just chiropractic, it's not just exercises, it's a complete step-by-step system designed to relieve disc pressure, calm nerve inflammation, restore stability, and help spine heal from the inside out. Let me show you how it works. S is for spinal decompression. This creates space in the spine and relieves pressure on the discs and nerves, the most common source of sciatica and leg pain. T is for therapeutic laser for the disc and nerve healing. It penetrates deep into the back to reduce inflammation, accelerate tissue healing at a cellular level, especially effective for chronic disc issues. R is for receptor and shockwave stimulation. It reactivates a dormant stabilizers to protect your spine and breaks up scar tissue that's limiting mobility. O is for orthopedic support and spinal mobilization. It corrects faulty foot mechanics and pelvic alignment that may be overstressing the spine, and so we want to restore healthy movement to the segments. N is for nutrition, fuel for the disc and joint repair. It supports internal healing with anti-inflammatory nutrition, guidance, and supplements. G is for guided spinal rehab and core support. It strengthens your core, retrains your nervous system, and rebuilds confidence in your movement, helping prevent future flare-ups. Is this backed by research, you say? Now, I know some people watching are skeptical, especially if they've already tried conservative care that didn't work. But this isn't just random treatments. This is a framework built on evidence. Clinical studies show spinal decompression can significantly reduce disc pressure and relieve nerve-related pain. One study reported a 90% success rate for chronic disc pain. Class 4 laser therapy has been shown to reduce inflammation, improve circulation, and speed up healing, especially for nerve-related back pain. These therapies are used in hospitals, sports medicine clinics, rehab centers around the world. Not because they're trendy, but because they work when applied the right way. So here's my advice. If you've been told surgery is your only option, but you haven't tried a structured, integrated, non-surgical approach like the BackStrong Framework, you may still have a window of opportunity, and I would strongly encourage you to explore that window before making a permanent decision. Because once you go through surgery, You can't undo it. But if you start healing naturally, you just might get your life back without the risks, without the downtime, and without all the what ifs. If this message spoke to you and you want to see if the BackStrong Framework is a fit for you, call the office today to schedule your consultation. We'll listen to your story, assess your root causes, and let you know honestly if we believe we can help. No pressure, no guesswork, just clarity. Because you deserve to know all your options before making one you can't take back. And if we can help, we'd be honored to walk you through the journey with you.